A dull throb spreads across your lower back while you're driving home. The kind of ache you blame on long hours at a desk. You promise yourself a hot shower and maybe a few stretches. Nothing serious. But halfway through cooking dinner, a cramp blooms deep in your stomach. At first it feels like ordinary gas, no big deal. Then it tightens behind your navel, pushes upward beneath your ribs, and suddenly you're clutching the countertop, wondering why two totally different parts of your body are screaming at the exact same time. Your mind races. You open your phone, type back pain and stomach pain together. Google spits back everything from harmless indigestion to pancreatitis, kidney infections, bleeding ulcers, even an abdominal aortic aneurysm. Each result feeds a new spiral of what-ifs. What if it's my kidneys failing? What if my gallbladder is about to burst? What if I rush to the ER and they say it's just gas? Will I look ridiculous? Yet doing nothing feels reckless. You can almost hear the seconds ticking while you stand there, spine throbbing, gut twisting, fear rising. Sound familiar? If so, you are not alone. In clinics across the world, family practice, gastroenterology, orthopedics, patients sit on exam tables describing pain that starts in my back and wraps around in my belly, or cramps in my stomach that shoot straight through to my spine. The overlap zone between lumbar muscles and abdominal organs is a perfect storm for confusion. Muscles, discs, kidneys, intestines, pancreas, and major blood vessels all share nerve highways that send mixed messages to your brain. The result? One mysterious signal hitting two separate alarm bells. Here's the scary part. Sometimes that signal is a harmless fender bender, trapped gas, a strained psoas, mild constipation pulling on lumbar vertebrae. But sometimes it's a 5-alarm fire, an inflamed appendix, a gallstone blocking a duct, an infection raging inside a kidney. How do you know which is which in the moment? Most people don't. They keep scrolling, pacing, guessing, begging the pain to pick a side so it makes sense. Meanwhile, anxiety tightens every muscle, including the very ones already irritated in your back and belly, creating a feedback loop that amplifies both pains. Doctors understand this confusion. In fact, emergency physicians often joke that the hardest diagnoses to nail are the ones that live in the gray zone. Pain too high for classic appendicitis, too low for heart attack, too far forward for herniated disc, yet too far back for gastritis. That gray zone is exactly where low back structures rub elbows with abdominal organs. A kinked colon can refer pain up the paraspinal muscles. A swollen facet joint can spasm the diaphragm and mimic epigastric cramping. No wonder you're not sure which specialist to call. But before you drive yourself into a full-blown panic, or worse, ignore warning signs. Take a breath. Knowledge is the antidote to catastrophic thinking. That's why this video exists, to hand you a clear, evidence-based roadmap through the maze. By the end of these next few minutes, you will know the 5 most common harmless causes of back plus stomach pain appearing together, and the quick, safe ways to settle them at home. The 4 dangerous red flag combinations, the ones doctors never want you to ignore, and how to spot them early. A 90-second self-test that tells you whether movement, posture, or digestion is driving your discomfort. The exact moment when watch and wait turns into get professional help today, so you can act confidently instead of guessing. Imagine trading tonight's dread for clarity. Instead of doom-scrolling symptom checkers, you'll have a short checklist of yes/no questions that funnels you to the right decision every time. You'll know why a bubble of trap gas under your left rib can stab into your shoulder blade, and why leaning forward might relieve a pancreas flare-up, yet worsen a disc irritation. You'll learn to identify the silent partners, fever, nausea, changes in urine or bowel movements, that elevate pain from inconvenient to urgent. Most important, you'll gain something the internet rarely provides: context. Context turns a page full of scary possibilities into a manageable flowchart. It tells you that cramps settling within 30 minutes of passing gas is worlds apart from a constant, clutching agony that laughs at antacids. It shows you why pain that waxes and wanes with posture belongs to a chiropractor or physical therapist, while pain that pulses regardless of movement belongs to a physician's office, and maybe to radiology for an ultrasound or CT. So stay with me. Set the phone down. Straighten your spine. Place one hand on your lower back and the other on your abdomen. Feel each breath expand your rib cage. Acknowledge the discomfort, but also acknowledge the curiosity rising in you, the part that wants answers, not anxiety. In the next section, we'll explore the benign mechanical and digestive culprits you can tackle tonight with stretch, hydration, and simple nutrition tweaks. After that, we'll shine a floodlight on the red flag conditions that demand medical attention, so you'll never confuse a life-threatening situation with ordinary bloating again. Knowledge is power, and power calms nerves. Let's turn on the lights together. Part 2, benign mechanical and digestive culprits. The pains you can usually fix at home. Your back aches, your belly cramps, and every alarming article on the internet is shouting pancreas, kidney, ulcer. But here's a reassuring truth. In the vast majority of double pain cases seen in primary care offices and urgent care clinics, the source is far less dramatic and far more fixable. This section pulls back the curtain on the everyday mechanical and digestive misfires that create a perfect illusion of something sinister. When you understand these usual suspects, you disarm 50% of fear before it starts. 1. Trapped gas and intestinal bloating. Picture your colon as a long garden hose coiled across your abdomen, then sliding upward under the left rib cage before turning downward against the back wall. When fermentation in the gut produces excess gas, think carbonated drinks, high-fiber binges, poorly chewed meals, the hose balloons in places, stretching the intestinal wall. That wall is rich with stretch-sensitive nerves that relay discomfort both forward and backward along shared spinal pathways. Result: you feel a pressure in your belly and a dull gnaw in the paraspinal muscles. Why it fools people: gas pain can be surprisingly sharp, even stabbing, and it migrates. One moment the pain nestles next to the navel, the next it punches the lower back or shoots beneath the scapula. Because gas pockets rise, the ache often worsens when you lie flat after dinner, then eases if you roll into a fetal position or kneel in child's pose. The spine seems involved, but isn't the real villain. Quick fixes that often work in minutes. Walk briskly for 5-10 minutes to jostle bubbles out. Sip warm peppermint or ginger tea to relax intestinal smooth muscle. Kneel with your chest of thighs and breathe deep into the belly. Burp or pass gas and the mysterious kidney pain evaporates. Nothing mechanical in the lumbar region resolves that quickly, which is your first clue it was digestive. 2. Constipation and the bowstring, psoas. Chronic sitters commonly harbor a tight psoas, the deep hip flexor muscle that runs from lumbar vertebrae to inner thigh. When the colon backs up with stool, it swells forward, tugging on the psoas sheath, which in turn tugs directly on the spine. You get front of abdomen cramping plus an arching ache at L2, L4. Straightening your leg while lying down or lunging the hip forward intensifies the yanking sensation. Telltale pattern. Discomfort peaks in the morning, eases slightly after the day's first bowel movement, then creeps back as stool builds. Bending one knee toward the chest often pinches, while gently rocking on a toilet seat or using a squatty potty position provides relief. Hydrating 2 liters daily, adding magnesium citrate, or increasing soluble fiber smooths transit, and over 24 to 48 hours, the back tension unwinds because the psoas stops acting like a drawstring on your lumbar lordosis. 3. Overfull stomach and slumped posture. Thanksgiving dinner ends. Family sinks into couches, and half an hour later Aunt Linda is massaging her low back while groaning that her stomach and spine hate each other. She's right. A distended stomach presses upward on the diaphragm. A slouched torso, rounded shoulders, forward head, puts the diaphragm on stretch and compresses lumbar facet joints simultaneously. The brain registers a blended discomfort, part epigastric fullness, part muscular fatigue, and lumps them into one alarming signal. Straighten up, take 3 slow diaphragmatic breaths, walk the block, and the double pain dissipates because posture resets intrathoracic pressure and unloads the lumbar facets. 4. Psoas spasm from prolonged sitting. Hour 6 of a Netflix marathon. You rise and feel as if a claw is latched onto both your groin and lower back. The psoas, chronically shortened in hip flexion, goes into protective spasm. It refers pain forward into the abdomen, because it lies behind the intestines, and backward into the spine where it attaches. People often mistake that front ache for digestive trouble and the back ache for a slip disc. Stand lunge the hip or glide your knee backward behind the torso for 30 seconds each side. As the muscle lengthens, both front and back pains fade. Add gentle glute activation to restore pelvic balance and prevent recurrence. 5. Menstrual cycle cramping and lumbar facet irritation. For menstruating individuals, uterine contractions can radiate through shared nerve roots to the sacral plexus, producing a dull belly ache that wraps into the low back. Meanwhile, hormonal shifts loosen pelvic ligaments, subtly altering lumbar biomechanics and making facet joints more irritable. The 1-2 punch feels like simultaneous stomach flu and back strain. Heat pad over the lower abdomen, light walking, and a non-steroidal anti-inflammatory often tame both sensations within hours. If pain aligns predictably with the cycle and lacks digestive or urinary red flags, hormonal cramping paired with mechanical irritation is a likely culprit. 6. Diaphragmatic tension and fake heartburn. Stress-induced shallow breathing tightens the diaphragm, a broad muscle with attachments to the lower ribs and upper lumbar vertebrae. A rigid diaphragm compresses the solar plexus region, mimicking upper abdominal cramp, while yanking on lumbar attachments to produce back soreness. Many patients swear they have reflux and sciatica simultaneously. 3 sets of 4-7-8 breathing. Inhale 4, hold 7, exhale 8. Plus conscious shoulder retraction often melt the sensation in minutes, revealing it was a respiratory muscle issue masquerading as organ drama. 7. Why these benign causes still matter. Just because a pain source isn't deadly doesn't mean it's harmless to ignore. Chronic bloating stretches intestinal ligaments. Tight psoas locks the pelvis in anterior tilt. Prolonged sitting dehydrates spinal discs. Over months, benign issues can see degenerative cascades, facet arthritis, disc bulges, pelvic floor dysfunction. Recognizing and correcting them early preserves long-term spinal and visceral health. 8. The 90-second home differentiation drill. Change posture dramatically, from standing to deep squat to gentle back bend. If pain fluctuates 30 to 50%, mechanical or psoas involvement is suspected. Add abdominal massage or knees to chest rocking. If gas passes and pain eases, bloating was a driver. Sip 250 milliliters warm water with lemon and walk laps around a room. Digestive origin will often calm within 10 minutes. Place heat on abdomen versus heat on lower back. Which side responds? Muscular tissues love heat. Infected organs typically do not change. If discomfort drops significantly after any of these steps, odds swing heavily toward benign mechanical/digestive causes. Stay observant for systemic signs, fever, vomiting, blood where it shouldn't be. Their absence builds confidence that you're in self-care territory. 9. Building resilience. Hydration habit. 2 to 3 liters daily keeps stool soft and disc juicy. Desk break ritual. Hip flexor stretch. Thoracic extension. 20 bodyweight glute squeezes every hour. Gas-friendly diet tweaks. Chew thoroughly. Mind FODMAP load. Introduce probiotic yogurt slowly. Avoid carbonated drinks when sitting long. Breath practice. 2 5-minute diaphragmatic breath breaks per day lower psoas tension and massage abdominal organ from within. Menstrual support routine. Magnesium-rich foods, gentle yoga flows, and heat therapy around period days to balance hormonal ligament laxity. Master these benign culprits, and you slice away most of the anxiety clouding every flare-up of simultaneous back and belly discomfort. In Part 3, we'll cross the threshold into the territory of danger. Kidney infections, gallstones, pancreatitis, and the rare but lethal abdominal aortic aneurysm. So you can separate Handle It Tonight from Hospital Tonight with surgeon-like precision. Knowledge, once again, will be your shield. Part 3. The red flag conditions. When back and belly pain means act now. In Part 2, we untangle the ordinary culprits. Gas, tight hip flexors, menstrual cramps, responsible for most back and stomach double aches. But honesty demands the other half of the conversation. The rare yet very real situations where that same pain pairing is a blazing siren. These are the conditions ER physicians think about when a patient clutches both waist and abdomen at triage. Most will never happen to you, but knowing their signatures could save your life or someone you love. Read slowly, absorb the patterns, then file them in memory under Do Not Ignore. 1. Kidney infection, pyelonephritis. Picture bacteria sneaking up the urinary tract, breaching the renal pelvis, multiplying in warm kidney tissue. The organ swells, its capsule stretches, and a deep, steady ache sets up camp beneath the last rib, often on just one side, sometimes both. Unlike mechanical pain, it doesn't change with posture. You could do cartwheels or lie motionless. The dull thud remains. Add fever, chills, and nausea, and you have the classic triad. Clue stack. Persistent flank or high waist pain indifferent to movement. Temperature greater than 38 degrees Celsius, 100.4 degrees Fahrenheit. Sweats that soak your shirt. Burning urination, urgent but scant trips to the bathroom, or cloudy, foul-smelling urine. Fatigue that feels like influenza without the sore throat. Delay here invites bacteria into the bloodstream. Sepsis can develop in hours. Oral antibiotics work if started early. IV therapy and admission may follow if you wait. 2. Kidney stones, ureteric colic. A grain of sand crystal breaks free, scrapes the delicate ureter, and your nervous system detonates a pain described by many as worse than childbirth. It begins suddenly, often after dehydration or intense exercise, and fires in waves from flank to groin. Between spasms, you might think it's easing, only to be doubled over seconds later. Because the ureter snakes near the spine, the agony radiates both forward into belly and backward into the back. Red flag cluster. Knife-like flank pain that surges and partially subsides, repeating in rhythmic hell. Nausea. Vomiting brought on by sheer intensity. Visible blood in urine, or dipstick positive for blood. Restlessness. Patients cannot hold still. Pacing actually offers momentary distraction. Pain unaltered by changing positions. Small stones may pass with fluid and medication. Large or obstructing stones require emergency imaging and possible surgical removal. Untreated obstruction can shut down kidney function within days. 3. Acute pancreatitis. Your pancreas lies deep in the upper abdomen, kissing the lumbar spine. When inflamed, often from gallstones or heavy alcohol, its enzymes digest the gland itself, releasing inflammatory chemicals that gnaw straight through to the back. Key pattern. Severe, constant epigastric pain boring into mid-back, worse after fatty meals, accompanied by relentless nausea and vomiting. Unlike gas cramps, no posture, no burp, no twist grants relief. Fever and a rapid heart rate are common. Lab tests reveal sky-high amylase or lipase. Why urgent? Pancreatitis can trigger internal bleeding, organ failure, and sepsis. Early hospital care with fluids, pain control, and sometimes ICU monitoring slashes mortality. 4. Gallbladder attack, biliary colic/cholecystitis. Tiny gallstones can plug the cystic or common bile duct like a cork. Pressure builds behind the blockage, inflaming both gallbladder and neighboring liver tissue. Pain explodes in the right upper abdomen, shoots into the right shoulder blade and mid-back, and mounts after greasy or fried food. It may ebb after a few hours if the stone dislodges, tempting you to ignore it, only to revisit stronger next meal. Warning combo. Sharp or cramping pain under right rib cage radiating to back or shoulder. Nausea. Sometimes vomiting with bile-tinged fluid. Pain triggered 30 to 90 minutes after eating high-fat foods. Low-grade fever or chills if inflammation becomes infection, cholecystitis. Yellowing of skin or eyes. Stone lodged lower causing obstructive jaundice. Chronic. Unnoticed attacks scar the gallbladder. Acute infections can perforate. Ultrasound or HITA scan confirms. And surgery is often definitive. 5. Peptic ulcer perforation. An untreated stomach or duodenal ulcer can erode fully through the wall, spilling acid into the abdominal cavity. The result is sudden, excruciating upper abdominal pain that radiates like a hot rod between shoulder blades. People describe it as being stabbed straight through. The abdomen becomes rock hard. Even shallow breaths hurt because the diaphragm brushes acidic fluid. Associated signs. History of long-term NSAID use, smoking or helicobacter infection. Brief window of relief when lying perfectly still, but pain returns with any movement. Rapid pulse, drop in blood pressure, clammy skin as shock develops. This is a 911 situation. Surgery plus antibiotics are life-saving. 6. Abdominal aortic aneurysm, AAA, rupture, the rare killer. The abdominal aorta is a high-pressure hose. Over years, it can balloon silently until its wall thins like wet tissue. If it leaks or ruptures, patients feel a tearing, crushing pain in lower back and abdomen, often with a sense of doom. They may collapse, pale and sweating, blood pressure plunging. Risk factors are age greater than 60, male sex, heavy smoking history, and family tendency. Only 50% reach hospital alive. Survival hinges on immediate surgery. The pain is so severe and sudden that most people instinctively call emergency services. Yet knowing the possibility ensures no hesitation. 7. Snapshot of when to seek care immediately. Pain hits 810/10 intensity, out of nowhere. You cannot find any position of comfort. Fever above 38 degrees Celsius, shaking chills, or night sweats accompany pain. Persistent vomiting, especially if green, bloody, or like coffee grounds. New jaundice, dark cola-colored urine, pale stools. Fainting, dizziness, heart pounding despite rest. Hard, board-like abdomen, or pulsating mass you can feel. Pain unchained for 24 hours coupled with urinary changes or blood in stool. If one item appears with severe pain, call your doctor the same day. 2 or more, skip the phone tree and head to emergency. 8. Why early action matters. Visceral organs escalate quickly. A kidney infection on Monday can spread sepsis by Tuesday. A migrating stone can block urine flow and destroy nephrons in a weekend. Pancreatitis untreated can cause multi-organ failure faster than you can schedule a clinic appointment. Hours count. Knowing the red flags lets you trade worry for decisive, timely action. 9. The emotion factor and decision paralysis. Fear does strange things. It either freezes you on the couch or sends you Dr. Google until dawn. Neither extreme serves you. Instead, cultivate measured vigilance. Observe symptoms. Run the benign test from Part 2, and if pain doesn't budge or a red flag surface, pivot immediately to professional care. Paramedics and ER staff would rather rule out something minor than meet you later in septic shock. 10. Bridge to Part 4. Now you own the mental checklist, distinguishing manageable mishaps from medical emergencies. In Part 4, we'll merge that knowledge with practical timeline, how to perform daily self-checks, tailor your hydration, anti-inflammatory diet tweaks, and posture resets, plus the exact phrasing to use when calling a doctor so you get the fastest, most accurate help. Information without a plan is useless. Stick around. Next, we turn wisdom into a routine you can live by. Part 4. Your 24-hour plus game plan. Daily self-checks, relief routines, and exactly how to speak to your doctor is almost equal to 5 300 characters. Knowledge is only useful if it becomes action. You now understand why harmless gas and tight muscles can masquerade as something lethal, and why kidney infections or gallbladder attacks sometimes hide behind generic back and belly pain. This final section turns understanding into a habit loop you can run every day, plus a red tape killer script for contacting medical professionals, so you get help fast instead of languishing on hold or misexplaining symptoms. 1. The 3-minute morning audit. Before coffee, before scrolling, give your body a diagnostic handshake. Posture probe. Stand. Place one hand on your lower back, the other on your abdomen. Bend forward to touch shins. Arch backward, fingers supporting lumbar curve. Side bend left, then right. Note, a mechanical cause will change greater than or equal to 30% in at least one position. Organ-based pain rarely wavers. Breath and belly test. Take a deep diaphragmatic breath so your belly rises. Does pain fade as the diaphragm descends, gas, diaphragm tension, or stay rock solid, visceral red flag? Vital snapshot. Keep a cheap digital thermometer and pulse oximeter on the nightstand. Temperature over 38 degrees Celsius or resting pulse greater than 100 while lying still. Combine that with pain and escalate today. Record findings in a 2-column phone note. Pain score/red flags. Tracking trends beats guessing. 2. The 30-30 hydrate rule all day long. Every 30 minutes of sitting. Stand, reach overhead, squeeze glutes 10 times. Twist gently left-right, letting abdominal organs glide. Every 30 minutes of standing. Lift one knee to chest, Hold 5 seconds each side. Roll shoulders back. Breathe deep. Hydrate. 250 milliliters water each cycle. Dehydration stiffens discs, slows bowel transit, concentrates urine. Perfect storm for stones, infection, constipation plus back spasm. 3 mealtime defenses. Plate composition for spine and gut harmony. 1/2 low FODMAP vegetables lightly cooked, spinach, zucchini. 1/4 lean protein rich in anti-inflammatory amino acids, wild salmon, turkey. 1/4 slow carbs, quinoa, sweet potato. Add a thumb-sized dose of healthy fat, olive oil, avocado, to smooth intestinal motility. Sip warm peppermint or ginger tea after the heaviest meal to disperse gas before it stretches the colon against your psoas. 4. The Gas Buster Mini Flow 90 seconds. Whenever belly and back start grumbling together, knees to chest rock 20 seconds. Massages colon, decompresses lumbar discs. Cat camel on all fours 20 seconds. Mobilizes spine, pumps discs. Wind relieving pose, one knee hugged, 20 seconds each side. Direct pressure on ascending and descending colon. Deep squat or toilet footstool 20 seconds. Straightens rectal angle. Encourages release. Pain drops? Likely benign. No change? Keep monitoring for systemic cues. 5. Evening reset. Before bed. 5 diaphragmatic breaths lying on foam roller placed lengthwise under spine. Opens rib cage. Freeze diaphragm. Warm compress 10-minute over lower back or abdomen, whichever feels tighter. Magnesium glycinate 200 milligrams plus 300 milliliters water for overnight muscle relaxation and softer stool in the morning. 6. The 1-week tracker and pattern decoder. Create a simple grid. Day, morning pain score, midday score, evening score, bowel movement quality, red flag symptoms. After 7 days, you'll see patterns. Pain spikes on high sugar days. Suspect bloating. Pain worse after long drives. Mechanical. Pain unlinked to position or food. Creeping up with low-grade fever. Escalate. Pattern strip drama from single episodes. Data calms a mind. 7. The call your doctor script. Beat phone anxiety. When red flags hit, every minute counts. Use this concise formula. Hi, my name is ___, age ___. I have simultaneous lower back and abdominal pain, rated ___/10 4 hours. It does not change with movement. I also have fever ___, degree C/vomiting/blood, and urine/black stool. I read that these could be serious. My history includes ___. Should I go to urgent care or are now? You've delivered location, intensity, duration, non-responsive posture, and systemic flags. Exactly what triage nurses need to route you fast. 8. Emergency department packing list, just in case. Keep a small grab pouch ready. List of medications, allergies, medical history. Latest pain log screenshots. Phone, charger, water bottle, ID, insurance card. Loose, 2-piece clothing for imaging exams. Arriving prepared shaves crucial minutes and reduces stress hormones that exacerbate pain. 9. Mindset armor. The 3-question pause. When fear spikes at 3 a.m., ask, has my pain changed with movement or position? Yes? Likely mechanical. Continue self-care. Do I have new systemic signs? Fever, urinary changes, relentless vomiting? Yes? Move to medical evaluation. Is the intensity trending upward, staying flat, or easing? Upward greater than 12 hours equals escalate. Flat or easing equals monitor. A 30-second pause prevents catastrophizing loops and guides decisive action. 10. Future-proofing your spine and gut connection. Core plus mobility training 3 times/week. Strong glutes, supple psoas, resilient diaphragm. Anti-inflammatory diet baseline. Omega-3s, low refined sugar, diversified fiber. Regular renal and hepatic screens if family history includes stones or gallbladder disease. Stress management ritual, meditation, laughter, or nature walks. Cortisol spikes tighten diaphragm and gut motility. Consistency converts temporary relief into long-term freedom. Closing rally. Back pain and stomach pain together no longer have to send you spiraling into late-night terror. Run the morning audit. Lie by the 30-30, hydrate rule, track patterns, and keep the red flag list taped inside a cabinet. Information is a flashlight. Routine is the battery. Combine them and darkness loses its power. If this series transformed your worry into a plan, hit like so the algorithm shows it to others lost in symptom confusion. Comment which routine step you'll start today. And subscribe because next week we dive into the 5 common drinks silently dehydrating your discs and upsetting your gut, and the 2 that heal both. Stay curious, stay proactive, and remember, mastery over your body begins with one informed decision at a time.